Hi, my name is Miranda. I'm going to be your nurse today. Can you tell me your name and your birthday?
Joshua Allen, 110698.
Thank you. So I see that you're here for a comprehensive physical exam. Is that correct?
Yep.
Okay. Do you have any allergies?
No.
Okay. So general observations that I want to look at is looking at his age, making sure his apparent age versus chronologic age, race, sex. I'm looking at any distress, and then next up is orientation. So do you know where you are right now?
Toledo.
Okay. What year is it?
2023.
What month?
December.
Thank you. And then he already told us the situation of what brought him in. So I'm looking at general appearance, noting any distress. I'm looking at his overall hygiene. I would want to check his height and weight as well as his vital signs, so his blood pressure, heart rate, pulse ox, respirations, and temperature. For his blood pressure, I want to make sure that I get it in both arms so that I can compare both sides. Next, I'm inspecting his overall skin for the color, looking for pallor, jaundice, any cyanosis, lesions, and rashes. Then I'm also going to be palpating for the temperature, checking for warmth. His skin's warm. Okay, so next I'm going to be inspecting his scalp for any bugs, any masses. I'll be palpating as well. Inspecting his face for facial symmetry, and then I'm going to be palpating the sinuses. I'm looking at the body hair, the quantity and the distribution. So that's on his head, his facial hair, and then both his extremities. I need to inspect his fingernails. I'm checking for clubbing. Cap refill on his fingers and his toes. Less than 3 seconds. To check his eyes, we could use the Snellen chart. Next, go ahead and look towards me. Making sure that his pupils are equal, round, and reactive to light. Okay, so next I want you to follow my finger, so I want you to look right here. So I'm bringing it in and out. And then next we're going to check the 6 cardinal fields. So next I'm going to be checking the ears. I could use an otoscope if I had one as well. So first I'm just inspecting, and then I'm palpating. So next is the nose. We already palpated the sinuses. So I'm inspecting for color, polyps. So next is the mouth. So I'm checking for any symmetry. Go ahead and open up and say ah for me. Thank you. So I'm checking the teeth. I'm inspecting the teeth, the hard palate, the soft palate. Good. And then I would also palpate those as well. So next I'm going to be inspecting the neck for symmetry, shape, and then I'm going to be palpating the trachea, making sure that it's midline. Go ahead and swallow for me. Good. Checking the thyroid gland. we'll defer the breast exam. So next is the lungs. So I'm expecting for any respiratory distress. I'm looking for symmetry, any pursed lip breathing, any nasal flaring, any audible wheezing or stridor that I might notice. Next, I'm going to be palpating. So next is percussion. So I'm going to have to percuss the lungs. And I'll do the back as well. And then next I'm going to be auscultating. So every time you feel my stethoscope, I'd like you to take a deep breath, okay? And the back. So next is the cardiac exam. So I'm looking for any abnormal movements. And then I'll be auscultating. So go ahead and breathe normal for me. Next, we want to check for any aortic or pulmonic murmur. So I'm going to have you lean forward a little bit and take a breath and hold it. Okay, so I want you to lay down for me. Oh. Okay, so I'm going to listen again. And then I'll have you lay on your left side to check your apical pulse. I would listen for a full 60 seconds. Good, thank you. And lean back for me. Okay, so next from here I want to check the check your arteries. So first I'm going to be palpating your carotid. So go ahead and turn your head to the side for me. Good. Other side. That one's the carotid. next I want to auscultate. Go ahead and turn your head to the side. Hold your breath for me. Good. Go ahead and breathe normal. Other side. Hold your breath. Good. Breathe normal. So that one was the carotid. Next I'm going to be auscultating the rest of his arteries. So I've got the abdominal. Next is the renal. Iliac. And then we're going to be deferring the femoral. While we're in this position, I'm going to check the pulses. So we already did the carotid. Next is the brachial. Next is the radial. Popliteal. Thank you. Posterior tibial. And then dorsalis pubis. Okay, so next we're going to have the abdominal exam. So I'm just inspecting the abdomen. I'm looking for any masses that I can tell at this time. I want you to go ahead and lift up for me. Thank you. Again, checking for masses or hernias. Next, I'm going to be auscultating the bowel sounds in all the quadrants and then in the epigastric. Next, I'm going to be auscultating over the liver. While Josh takes a deep breath, so take a big breath for me. Good. And then next over the spleen. Good. So I'm listening for any friction rubs. Next, I'm going to be percussing over the entire abdomen. Next, I'm going to be checking the liver border. You can measure that with a ruler. We have 6 centimeters. We're going to move to light palpation. So I'm going to lightly palpate all 4 quadrants. Let me know if anything hurts, okay? Any pain? Okay, so we're going to move on to deep palpation. All 4 quadrants and then the epigastric region as well. Good. Any pain? Good. Okay, go ahead and lean forward for me. We'll be checking the kidneys for any tenderness. Any pain? Any pain? So next is the musculoskeletal section of the exam. So go ahead and stand up for me. And so we're looking at the curvature of the spine. Throughout this exam, we're going to be looking at his gaits and his movements throughout the exam. So follow my movements. Go ahead and abduct the arms, adduct, extend, flex. Any pain? Okay. And bring it back. Any pain? Okay. Go ahead and walk for me so I can observe your gait. Thank you. Go ahead. Go ahead and sit down for me. So we can check each joint as well. So shrug your shoulders for me. Good. With resistance. Good. Turn your head to the side. Good. Other side. Good. We can check the elbows. So this elbow, I can palpate, feel if there's any pain, any masses, tenderness, edema. For the deep tendon reflexes, I would use a hammer to check those. And then for part of the neuro exam, I'm going to have you close your eyes, and then I'm going to be placing a sharp and a soft. So you're going to tell me if you feel sharp or soft. Sharp or soft? Sharp, good.
Soft. Sharp.
Sharp, okay.
Soft.
So keep your eyes closed. I'm going to be moving on to your extremities.
Sure. Soft.
Good. And then
Soft.
onto your legs. Good.
Sure.
Good. Very good. You can open your eyes. So that completes our exam.